Chapter 11, special problems, discusses the different types of assessments that will be done and the different type of clients that we'll see as depressed clients. It discusses their mood disorders and the questions that we can ask the clients, like, have you felt sad or down most of the day, every day, more than 2 weeks? If yes, the client should see a mental health professional. We should trust our clinical judgment. Increase in goal oriented behavior is essential. Recovery skills, relationship skills, and stress reduction skills. We need to discuss their feelings and what they're going to do to feel better. Depressed clients. Depression is a mood disorder that causes a persistent feeling of sadness and loss of interest. It affects how you feel, think, and behave and can lead to a variety of emotional and physical problems. The grief process. Um, how grief is normal and it lives within 2 to 4 months. Clients deals with the loss gradually and moves forward. Delayed grief can occur months later. Depression can lead to suicide. There are 3 phases of suicide: increasing thoughts, planning, and finishing their plan. Our job is to help reevaluate the situation and promote change and hope. Depression is an illness that you can recover from. It is not a fault, but a sickness and not a punishment. A higher score on the HAMD puts the risk factor higher for a client. Anger clients. Anger has a lot of energy behind it. It is important that it be redacted into more positively recovery program. We need to teach them and encourage them to think before they act. If the client exhibits violent behavior, then they do not belong in the treatment center. We should request that they be removed and sent to a psychiatric facility where they'll have more resources to deal with them. If the client becomes verbally or physically violent, they need a timeout. Basically, they need to be removed from the situation before anything escalates and gets out of hand. Homicidal clients need to vent their feelings and process through their options. They need assistance processing logical conclusions, and it's our duty to warn. We have the obligation to protect an intended victim if the client presents a serious danger of harm. We have to understand the balance between our duty and confidentiality. It talks about personality and how personality refers to the individual different characteristic patterns of thinking, feeling, behaving, and your character, what we learn about, what to do, and how to behave, shaped by our environments. Antisocial personality has a biological base and tendency to act aggressive and impulsively. They have a diminished capacity to delay or inhibit action, aggressive action. These clients act fast on their feelings. They have a disorder of empathy, meaning that they're not able to show their feelings adequately or that they're capable of doing so. So we need to help them establish a way to understand their consequences and not to blame others and take responsibility. The moral development stages: is it right so long as I can get away with it? Is it right if it is within the law? Is it right because I believe it is right? A borderline client: the tendency to act impulsively plus emotional instability. And it goes through different their emotional regulation, how to treat the borderline client in dealing with their family. It also breaks down the narcissistic client, which has a sense of self-importance. The anxious client, which has a generalized fear. Mm. And it talks about the cognitive therapy, post-traumatic stress, panic attacks, the psychotic client, high-risk clients, the client with the low intellectual, the importance of setting rules,